ready.
I'm ready.
Okay. So what we have here, we call that the SVC, the superior vena cava. That's what will dump deoxygenated blood into the right atrium. So all of this is the right atrium. So what is this below here? That is your right ventricle. So where's the left atrium located? Left atrium on the top on the patient's left side, that is your left atrium. So this must be the left ventricle. What is this? The pulmonary trunk. So looking on this, we have the aortic arch. Looking on this picture, you can barely see part of the aortic arch. This structure number 6, that's the structure which anchors the aortic arch in place. We call the ligamentum arteriosum for that. So let's look at this model right here. So we have right atrium. If you open this up, right ventricle, left atrium up here, left ventricle. What do we call these cord-like tendons? These cord-like tendons, we call that the chordae tendineae. They not only attach to the papillary muscles, but the chordae tendineae also attach to the atrioventricular valves. Atrioventricular valves, in this case, between the left atrium, left ventricle, we call that the bicuspid valve. Another word for that is the mitral valve. So looking between the right atrium, right ventricle, we have the chordae tendineae connecting to the papillary muscle and to the AV valve located between the right atrium, right ventricle, we call the tricuspid valve. Think of tricuspid as tri on the right side of the heart. So here we have the pulmonary trunk. At the base of the pulmonary trunk, we call that the pulmonary SL valve. That's called the pulmonary semilunar valve. So the pulmonary semilunar valve, pulmonary trunk, you can see how it's labeled blue because it contains oxygen depleted blood. So from the pulmonary trunk, it will divide to form 2 structures. Those 2 structures we call the pulmonary arteries. So here again is the ligamentum arteriosum anchoring the aortic arch in place. That's the ligamentum arteriosum. Here we have the pulmonary arteries. Arteries normally carry oxygen-rich blood. Exception would be the pulmonary vessels. So the pulmonary artery contains oxygen-depleted blood. These are colored red. Are those the pulmonary arteries or the pulmonary veins? That would be the pulmonary veins. How many do we have? You can see there's 2 on this side and 2 on this side as well. So here's the pulmonary veins, 2 of them, and here's 2 more. So we have 4 total pulmonary veins. We only have 2 pulmonary arteries, 1 here and then 1 on the other side as well. Turning the heart upside down here, we have the great vessel that dumps deoxygenated blood back into that right atrium. This we call the IVC, also known as the inferior vena cava or the actual cava. So here's the IVC. This is the coronary sinus. Coronary sinus contains that deoxygenated blood when the heart actually used oxygen-rich blood to contract. So coronary sinus, IVC. What is this artery? Is it the anterior or the posterior? So when you look at the IVC, automatically think you're looking at the back and bottom portion of the heart. So this is the posterior interventricular artery. The posterior interventricular artery between the ventricles branches off of the right or left coronary artery. That would be the right coronary artery. So we can ask, okay, what is this part of? What coronary artery? That would be the right coronary artery. Right coronary artery branch of it would be the posterior interventricular artery. If you look at the front of the heart, which is kind of missing the top portion, we're looking at the front. You can identify the pulmonary trunk. You can identify that aortic arch. What you can see, this is the anterior interventricular artery. Interventricular because it's running between the ventricles right above the interventricular septum. So this anterior interventricular artery is red, like the posterior interventricular artery. This will branch off of the left coronary artery. So when you talk about the left coronary artery, the abbreviation is LCA. So left coronary artery, the A stood for the anterior interventricular artery right there. So to recap this, we have the pulmonary artery, one here, one on this side, and then we have the pulmonary veins, which will be the opposite color. So pulmonary veins are normally blue, exception would be the pulmonary vessels. So here's the pulmonary veins, which we have 4 of them. So when you look at, let's look at this model. Right atrium, left atrium, right ventricle, left ventricle, anterior interventricular artery, which is part of the left coronary artery. Here is the pulmonary trunk. Here is the SVC, the superior vena cava. Here is the aortic arch. Also, we have, where did the coronary arteries come off of? They will come off of the beginning portion of the aortic arch we call the ascending aorta. So let's look at this next. So here's the SVC meeting up with the right atrium. What cell produced the natural pacemaker rhythmic contraction of the heart? That would be the SA nodal cells. So to identify the SA node or the SA nodal cells, you want to identify the SVC on the inner surface, where the SVC meets up with that right atrium right on the inner surface. That's your SA nodal cells. So here we have the pulmonary trunk branching into the pulmonary artery on the left, and then the pulmonary artery on the right. Then what I didn't really go over is you can see how there's 2 branches. Those would be actually merging into one ultimately to form the pulmonary artery. So here's the pulmonary artery on the left, and then here's one on the right side. So pulmonary artery blue, pulmonary vein red. How many pulmonary veins do we have? 4. So 2, and then if you switch it over, 2 as well. If you take this off, what is this opening on the bottom called? We call that the IVC, inferior vena cava. When you identify the IVC, you're looking at the back and bottom portion of the heart. You can identify IVC, coronary sinus, which is right here. You can identify the posterior interventricular artery, which is part of the right coronary artery. Looking at the front again, you can identify as the anterior interventricular artery, which is part of the left coronary artery. If you open this up, what you can see here is, so we have the SVC, then we have the SA nodal cells, which will be on the intermedial parts, right atrium, right ventricle. What is this right here? That is your left atrium. Here is your left ventricle. Here's your interventricular septum. Here is the pulmonary trunk at the base, the pulmonary semilunar valve. So where's the aortic semilunar valve located? So the aortic semilunar valve is going to be deep to this interventricular septum. It's going to be located, I don't know if you can see, right here. So here we have the aortic semilunar valve. You can see it's in the left ventricle, so in the left bottom chamber, but it's going to be really deep inside. That's your aortic semilunar valve. So valve between the right atrium, right ventricle, we call that the tricuspid valve. You can see how it's kind of blown out. It's not really shown there. Valve between the left atrium, left ventricle is going to be the bicuspid or mitral valve. The valve located a little bit medial to the bicuspid mitral valve at the base of the aorta, we call that the aortic semilunar valve right there. Let's look at this.